Well, by the time he spent several years putting this all together, he had a good doctor staff, a good nursing staff, but he needed a hospital. So we all got together and we built a hospital, a modern, up-to-date, beautiful hospital, something that was beyond belief before he surveyed the place. And of course, the hospital also helped prepare doctors and nurses for tropical medicine and the special kinds of things they had to do there at San Pedro. It was so successful that while we dedicated the hospital with about a $2 million debt, within a few years that debt was paid off. It was paid off about 3 years before we anticipated it would be paid off, due to a lot of very generous people in the States who understood the vision of bringing modern medicine to what was practically a medieval town, if you will. And that was the case throughout Ecuador. And it was so successful that the Ministry of Health asked Dr. Gaus to see if he couldn't do something the same in another town down that road, another hour along the road, closer to the sea, which had certainly pretty much the same situation he'd encountered at San Pedro Maldonado. So he sized the place up and decided what they really needed was a modern hospital. They needed a hospital that involved teacher training in the diseases of the area. It needed nursing training, and it needed, of course, doctors who could dedicate their lives to that kind of work. He planned a rather spectacular approach with a building that is both a hospital, a teaching facility, a look to the future needs, and a follow-up care for those that were taken care of. It's a wonderful dream. It's going to cost a few $1 million, but we were so successful at San Pedro, and so many of his good friends came up with the ante to get that off the ground and help pay off the debt in 2 years before it was anticipated, that we're all filled with hope that now with this new dream we can do even something greater. We go to a city or region that's twice as large population-wise. It has the same kinds of problems that were at San Pedro. They are in large measure unanswered at the moment. And you have doctors who are graduates of the medical school at the University of Quito, Ecuador, where they just don't have an organized way of getting to work as doctors, and they wind up doing all kinds of other things. So we not only bring together the forces of medicine, which are now scattered all around, but we build a facility in which they can dedicate themselves to modern health care of these poor, benighted people who are on the fringes of health care. And I think it's a wonderful opportunity to not only look back on what David accomplished at San Pedro Maldonado, but to trumpet by building something twice as big, which is not only a hospital, but a teaching facility for the future. And that will double the effect of medical care in that part of the world, which is really benighted at the moment.
Thank you, sure.
Well, if you take this as one of those worst-case scenarios, and David's already proved that he can walk into a worst-case scenario and make it blossom like a rose, and to have first-rate medical care 24/7, I mean, all day, all night, 7 days a week, and reach out to get components that could be part of this but now are wasted, and bring them back and put them to work productively, and to bring modern medical care and techniques and all the modern facilities that we're acquainted with in America, but which are unknown in this part of the world. It's a wonderful step forward, and it could be replicated. I think if we could look at San Pedro and what happened there, and now in Santo Domingo and what's going to happen there, we hope, that will be a model for many other countries in Latin America that face the same kinds of problems as Ecuador. Some may be a little better off. There are probably some that are worse off. But in any event, it proves it can be done using local resources. If we get a little boost to begin, we need a facility, we need the kind of equipment that will set up modern medical care. We've got the people. We have people who have already had book knowledge in their medical training, but this will give them hands-on experience with modern medicine and modern methods. It'll simply revolutionize the healthcare of that part of the world. And I think if you do that, it'll be contagious. Many other countries will get the vision and do the same thing. And we are really creating a paradigm that other nations can follow.
And then finally, Father Hesburgh,
I think all they would have to do is take a look at San Pedro before David arrived and sized up the situation and what it is today. It's day and night. It was night when he got there, now it's shining day. And we've proved it can be done. It can be done by using local resources, but we have to add the boost of a facility that's set up to teach modern medicine and organize people who have had medical training, but mostly out of a book, not out of experience, to bring them in and give them the clinical experience to practice their medicine. And we're bringing to life people who wanted to be doctors but never had a chance because there were no facilities, and they really didn't learn the kind of hands-on medicine we teach in this country.